Okay, what do you do about health insurance between FIRE and Medicare Age? It's a good question. It's a common question, right? Because Medicare starts at age 65. I retired at 43. That's a 22-year gap to cover. That's a lot of ground. So what you do is you buy it. You buy healthcare. Tens of millions of people do this, right? Now, some of those people are self-employed. Some may not have a job by choice or not. But many people have to pay for their own healthcare coverage. So how do you do that? Well, the first question is, do you want true health insurance? If yes, then you look for the best policy that makes the most sense for your family. If you're willing to pay for healthcare coverage that isn't necessarily insurance, there are other options that exist, and that includes healthcare sharing ministries. Now, I'm not a huge fan of those. They do work for some people, but they're not true insurance. There are annual and lifetime caps on the amount of coverage that they will provide you. They don't actually have a legal or true obligation to reimburse you for any healthcare needs that you have. And most of them have a religious affiliation, and they'll take a moral high ground on what they will cover. So, for example, certain immoral activities and the resulting health-related consequences may not be covered. So think like anything related to alcohol abuse, accidents under the influence of alcohol or drugs, rehab to help get you or a family member, a child, out of issues with alcohol or drugs. Premarital sex can lead to other things such as pregnancies, and they can say, no, we don't believe this is fitting with what we want our members to be doing. And so, if you have a few drinks and get in a car accident, if your son or daughter gets in with the wrong crowd, you could have incredibly high healthcare expenses that will not be covered or reimbursed. And that's just not enough of a safety net for what insurance is supposed to be, in my mind. So I looked at those different policies, but I decided to go with true health insurance. And to buy health insurance, well, you can use an insurance broker. There are people that will look around for you, see what they can find. There may be some kind of an association policy, a group policy that you would be eligible for. But I think most people will simply start at healthcare.gov. That's the nation's healthcare insurance exchange. And your state may have their own exchange set up. And if you start at healthcare.gov, it will send you there. So that's how I found mine. We're in our third year now with a high deductible bronze plan that has an HSA. We pay just over $1,000 a month for a family of four here in 2022. That's gone up a bit from $950 or so to $980 to now I think $1,050 roughly per year. It's an expense that we will expect to continue to go up, and we planned for that expense before I quit my job. So make sure you're thinking about that before you consider early retirement. But again, you just pay for it.
Do you want your questions answered by the White Coat Investor? Record your question at whitecoatinvestor.com/YQA or click the link in the description.
The hosts of the White Coat Investor podcast are not licensed accountants, attorneys, or financial advisors. This podcast is free entertainment and information only. It should not be considered professional or personalized financial advice. You should consult the appropriate professional for specific advice relating to your situation.